morning, ma'am. So, I'm Charmaine Vicente, your student nurse for today from Notre Dame Tacorong College. So, now I will demonstrate on how to assess the respiratory and cardiovascular system. So, first is assessment. So, first, assess the client physical and psychological aspect before and during examination. To gather complete data about the client health status. Next is review body areas to be examined. Examiner or healthcare provider identify which part of the body is to be examined systematically. Make a physical and environmental preparation before examination. Proper preparation of environment, client, and equipment ensures smooth physical examination with few interruptions. Next is identify the client to gain cooperation. Next is explain the procedure to the client to gain trust and cooperation. So, ma'am, I will assess your respiratory and cardiovascular system. Properly position the client to make patient feel comfortable. Next is take the health history of the client to have a comparison with previous illness and present health condition. So, ma'am, may previous illness ka ba?
Wala.
Present health condition?
Wala din.
So, next is conduct physical examination using the 4 skills in assessment to assess, determine, and identify abnormal findings in the body system. So, for assessment process, health history, cough, may recent ubo ka ba, ma'am?
Wala.
Dyspnea,
Wala din.
chest pain,
Wala din.
past health history,
Meron.
assess family history, meron bang chain smoker sa inyo?
Probably mga second-hand chain smoker.
Ikaw?
Yes.
Psychosocial profile, mahilig ka ba punta sa crowded places?
Medyo.
So, to have a comparison with previous illness and present health condition. So, next is assessing the respiratory system. First is chest respiratory rate, rhythm, depth. To identify any abnormalities based on normal stage. Next is symmetry of chest movements. Equal chest movements. Equal. Next is spinal deformities. To identify any deformities of the spines, scoliosis, kyphosis, and lordosis. So, straight naman, ma'am. So, next is muscle for breathing, to know if there is any effort breathing. Ma'am, hinga po ng malalim. So, okay naman. So, next is palpation, trachea. To check proper position of trachea. Next is chest, tenderness, and muscles. Could be susceptible to have tumor if present. So, next is tactile firmitude, a vibration felt on the patient chest during low frequency vocalization. So, ma'am, magsalita ka ng 99. So, meron. Next is percussion, chest. Note general percussion sound to evaluate normal percussion sounds. Next is auscultation. Breath sounds, anterior, posterior, and lateral, to identify and differentiate normal to abnormal breath sounds. Next is adventitious sounds, crackles, abnormal lung sounds characterized by discontinuous clicking or rattling sounds. Next is wheezes, high-pitched whistling sound made while you breathe caused by is Ronkai, are continuous low-pitch, rattling lung sound that often resembles snoring, obstruction, or secretion in larger airways. Next is grunting, a sound made by a baby who is having trouble breathing. Assessing the cardiovascular system, first is inspection, neck vessels, identify carotid arteries and jugular veins. So, the carotid arteries carries oxygenated blood up to the head, while the jugular veins drains the oxygenated blood down to the heart. So, carotid arteries, so dito, then jugular veins dito. So next is palpation, neck vessels, carotid, palpate carotid separately, um, dito. Then rate and rhythms, note the size to know any abnormalities in comparison to the normal ranges and size. So next is percussion, precordium. Note general percussion sound. Identify cardiac borders. Right, left, inferior, and superior borders. So next is listen for bruits. Bruit, a sound heard over an artery or vascular channel. So next is jugulars. Use bell of stethoscope. Have patient hold breath. So ma'am, hold your breath naman. Next is listen for venous hum. So, venous hum is a continuous machinery-like noise heard over the internal jugular vein at the base of the neck. Differentiate venous hum from carotid bruit. Venous hum is a continuous machinery-like noise heard over the internal jugular vein. Then, carotid bruit is a sound heard over an artery or vascular channel. So next is precordium. Identify 5 positions for cardiac auscultation: aortic, pulmonic, tricuspid, mitral, and herbs. Listen at all costary sites: apex, left lateral, sternal border, bases, xiphoid. Next is rate, rhythm, pitch and intensity, duration, quality and location, murmurs, to differentiate and evaluate heart disorders. Evaluation, make findings of health assessment and physical examination done on the client. Documentation, record, document, and report any pertinent findings found during assessment of appropriate personnel.